esteemed principal, Professor Fazil Saab, Professor Ishfaq Saab, head of the Department of Anatomy, Dr. Sajjad Saab, Dr. Rule, faculty members of Department of Anatomy. And it's a pleasure to be here on this academic event being organized by Professor Ishfaq Saab. Now, he has taken a lot of pains in inculcating all the teaching manuals for understanding the anatomy, because anatomy forms the backbone of the medical profession, more so for those who want to offer surgery, surgical branches, be it general surgery, orthopedics, gynecology, ophthalmology, NT. So it is very important. Once your concepts are clear, then you will be the better surgeons. So one thing, the way your faculty is working very hard to make you comfortable, to teach you. So we as students have to reciprocate. You have to show your love,
The greatest happiness for a teacher is once he sees his student growing much beyond him. Once he sees a student in a much better position. So always think, if somebody is showing a little hardness, a little firmness in teaching you, in your attendance, in your behavior, so ultimately his aim is only one thing, that you get better and better with each passing day. Never take hard teachers as your enemies. Never think that this department and that department in particular, medical, is toxic. No, that's not true. Trust me, ultimately you remember only hard teachers. You remember only those hard days, because they help, really help you to excel.
First of all, I welcome this new series of the anatomy with the clinical aspects, starting with the Department of the Anatomy under the guidance of our dynamic faculty, Dr. Ishfaq Saab. I think this series will go on. We have detail, the classification, and the rest of the topics will be taken in the due course of the time by the other presenters.
This session is not merely discussion of common medical conditions, but it's a step forward in bridging the gap between the theoretical knowledge and the clinical application. This initiative reflects our commitment to evolving medical education, moving beyond textbooks to bedside learning, and preparing our students to become competent and confident medical practitioners tomorrow. As a medical student, you're a lifelong learner, and such sessions help you build habit of self-improvement and continuous learning. I extend my sincere gratitude to Principal Dr. Fazil Sir for his constant encouragement, and to the Department of Faculty Anatomy for their dedication, and students for their enthusiasm.
Mentioned for the certain. We don't give cosmetics. It is nothing cosmetic. It is always a teamwork. It is nothing. The thing is that it's a collective effort. Everybody is equally involved. I am the least involved. I did not come on the stage. I am just to monitor the things. So that is why it should have been a question answer session. And the next topic will be divided into parts A, B, C, D, and there will be 4 to 5 presenters as one part. Second thing is that as far as this activity is concerned, it is just to remove phobia, anxiety, so that a student gets an opportunity to present himself or herself. And in the end, those students who I just volunteered, I thank them, and I just, because what happens, it's an initiative. So those people who came forward, the others have to follow. In the end, we will start with giving certificates from the Department of Anatomy and those by the Principal Medical College, Smith Medical College, because initiative is important. Negativity is something you keep on the shelves. I am a person who is positive in life, always positive, and this is the positivity which I want to bring into here, and all other students should follow. And I will also just recommend SRs of my department to follow the suit. This is just to show that a student at any level, at the first MBBS level, can just do wonders. So these are very important, and we have selected the topics which you will remember. You will not understand the importance at this stage of time. You will understand the importance once you are in your surgery, once you are in your internship, once you are doing for NEET PG or any form of examination for that matter. Anyway, I wish all of you best of luck with your academic pursuits as well as best of luck. Thanks a lot.
Esteemed Head of Department Anatomy, respected other faculty members and my dear fellow batchmates. Myself, Hazim Ramzan, and I feel very glad to present a concise overview on a very important clinical topic, hernia and its levels.